Well, here we are talking on the last leg of the show about the university and what it means to us as a country. We have Dr. Darius Kofi Osei, CEO of the University of Ghana Medical Center. He joins us now for a conversation. Dr. Osei, a very good morning. Thank you so much for making the time to be here with us this morning.
Right, good morning, and thanks for having me.
Great. Even before we get into the nitty-gritty about phase 2 and what it means, give us some historical antecedents. Tell us about
the concept had been on the drawing board since Nkrumah's time, but the first contract was signed by the late president of the country, Professor Atta Mills.
Right.
And then the construction started in 2013. The phase.
So that's the long and short of it.
Yes.
Okay. We're told now that the UGMC is fully operational. What does that mean? I mean, have you not been, you've been operational in the past. What does fully operational mean in this context?
We were operationalization process, and then now it is fully operational. So what it means is that, it was a turnkey project. And turnkey means that the contractor is building, equipping it with some few
proper infrastructure.
Well, infrastructure, but if you look at the building from outside, it looked like it was ready, but most of them had only the ground floors ready. So for all this time, we're running 100 bed as against 1,000 bed potential.
Wow.
So when we say operationalization, then it means we have activated all the 1,000 bed now.
Okay.
Now,
so
it means when you go there in that empty building, we have equipment there, you have empty rooms and all that. You needed to get your administrative staff in place, and then you needed to have the different professionals. And then these equipment are going to be worked on human beings. The photo imaging equipment, for instance, the radiation levels will have to be tested, and then the radiation authority will have to give you approvals. And then you need to make sure that every equipment that has been supplied beings can use them.
Right.
Now, you need to engage staff, and then staff engagement must make meaning in the objective of the facility.
Right.
Because it's a specialized facility. It means from the layman point of view, everybody is a doctor. But we've been scaling up, trying to get doctors as the business was gradually coming up. And as I speak, we have about 809 staffs, 147 doctors and 47 senior specialists and consultants.
Right.
And then you have an ICU of about 36 beds.
So though I'm not truncating your line of thought, but if I do the math, about 147 of those doctors, 1,000 beds, so that means that's just an average, though, more or less. But of course, the specializations.
You have to look at the content. And again, we also, as part of establishing ourselves, have sponsored most of these doctors to specialize, because it is very difficult getting the ready-made doctors who are specializing in various areas.
School right here in Ghana?
Yeah, right here in Ghana, right, in the College of Surgeons in West Africa. So we're anticipating that in the next 3 years or so, they will come back because they are bonded, so that we can complement the full capacity of what is needed.
Okay.
Right.
Most people have not even known about this second phase.
Right.
What was it supposed to deliver, and what has it delivered as of now?
Phase 2 brought a lot, which had meaning into phase 1, because phase 1 was giving us the OPD services and limited space in inpatient. Okay. Like I said, we're only able to 100 bed, which means we were very measured in our operations in terms of what we can. Phase 2 brought on board the extra 1,000 beds, even though most of the beds were there, but the divisions were not properly functioning, and the equipment that was required to make these areas functional. It brought the cath lab that is there for the 8 doctors Bangalore, and then we also were able to get the other functions. Mind you, we are not only doing the clinical side, we also have a research and then simulation and training. So all these were part.
Basically, we're good to go now.
Definitely so. We are ready.
You're not just another hospital. There's a lot more to you than just being another hospital. Like you said, you're a specialized hospital. But you have 3 focal areas at the UGMC. Tell us about those focal areas.
Yeah, we have the largest. It means is, most medical schools use live sick people to do their studies in terms of critical. Now we have the mannequins and other things that simulate and mimic medical conditions.
Oh, wow.
So it means we use our facility in terms of clinical practice. Also, it is not only for medical training. As I speak to you, we are going to train about 50 STC drivers about basic life skills.
STC drivers?
That is State Transport Corporation.
Yeah, no, I get it.
Yeah. So
how does that feed into?
Yeah, because they are taught how to, basically save lives when there is accident or something. Over here, for instance,
consolidated bank.
Yeah.
Right.
If somebody should fall here at your workplace, I'm sure if you have the skills, you should be able to save the person's life immediately. So
CPR.
Yeah, that's
some of those basics.
So this training and simulation center goes beyond just both for clinical and non-clinical persons.
This is great. This is.
And then we have the third, that is the research.
Right.
We managed to get fellows in research as part of our staff, which is difficult. Mostly they are in the universities. But this time we have fellows who are part of our staff who will now research.
Right.
When we are going to do artificial reproductive technology, that is the IVF, when you are going to do cardiovascular operations, then there should be some data that must have some research meaning, capacity that is required, so that we can complement the clinical areas in terms of research.
So your outfit is fully operational now. 1,000-bed, you're bringing on the doctors. I'm sure you're going to even add on more doctors as time moves on. But what change will this really bring to bear? What is...
So definitely, if we have just one presently operating in Korle Bu, then we are going to complement that kind of cutting-edge service. We are looking at the minimally invasive procedures that people travel out of the country to do.
So surgery, but not complicated.
Yeah, more or less we are looking at medical tourism, what medical practice. So that is why we say quaternary. It means above the generics, subspecialties. When you used to have general surgeons, now we have moved to different branches of general surgery in terms of subspecialties. And these are the things that send people out of the country. And we are focusing in getting all those services for UGMC, so that at least we can focus the care of our citizenry and out. We are looking at the whole of West Africa and beyond.
And Korle Bu has played that role for a long time in the West African sub-region. You hear people from all over West Africa coming to Korle Bu. So you're going to take some of the burden off of them.
Definitely so.
And add on more specialized
I'm not saying that we are not already giving some of these services. Korle Bu is doing it. But, the focus here will focus, because we don't have the 3-tier system. Korle Bu has the polyclinic, and then
like most of our public, 37 also does.
But here, we don't have general practitioners sitting in our consulting rooms. So all of them are being managed by specialists. So that is why mostly we're talking about referrals, so that when the lower levels have exhausted their capacity, they refer to us so that we continue the care.
Are there any others?
Yeah, we have.
Apart from those that you've mentioned.
The cat lab for...
the what?
The cat lab, the angiography.
Okay.
Where people hearts are stopping, blocking, and then we immediately can salvage them. We have the artificial reproductive technology that is popularly known as the IVF for women who have a problem with childbearing. Definitely is an area that will be patronized. We also have a whole, sleep medicine. It's not something people have thought of. Sex dysfunction area. So these are narrow specialties that we intend to focus on so that we can solve the problems.
And in respect of the clinical section, do people need referrals? You know, some of these big hospitals, you need to have been referred from a smaller hospital or a polyclinic. Do they need referrals before they come to the UGMC?
Let me clarify. If you take the women and children, for instance, so if UGMC has your facility, if you in need of childbearing, for instance, and you want to benefit from the artificial reproductive technology, definitely it's not a referred area.
Right.
If you have any secondary condition, like a diabetic or hypertensive patient, definitely you can decide to use our specialists who are there. But what we are saying is that your primary doctor should give you maybe your medical records.
Right.
If you are 50 years, definitely somebody is seeing you already. And so what can we learn and then continue from there?
It can't be a tabula rasa. It must be a continuous process. In terms of research, you touched on it briefly in terms of what do you stand to do, or what do you hope to do in the area of research as a medical center?
Yeah, we talked about genetics medicine. We are talking about, in fact, last year, for instance, you know, we became popular for the COVID treatment.
Right.
So we've managed to interested party. So it's all about research grants and then how you assess it. And I said before, we have the research fellows who are able to write for the grant. And it should make meaning in our clinical practice. So that is how we want the research section to function and then make, work together so that we can have an operation.
Everywhere you go, you would see a vision and a mission. What is the vision for the UGMC? Yeah. Where do you aspire to get to eventually?
Yeah, eventually we want to have UGMC as the hub to answer all the healthcare needs of the country. And then maybe we can minimize the people traveling out of the country. People can have hope that, all the, also be able to deliver that to them. That is the vision. And
right. It has indeed been refreshing. I mean, hearing all the news, sometimes not exactly positive from the past, and when are we kickstarting the facility and all of that. But it's really refreshing to hear that we've done that. Phase 2 is signed, sealed, delivered, and top quality. And you're hoping to do health tourism, basically.
Right.
We wish you the very best.
Thank you.
And thank you so much for joining us.
Thank you for having me too.
Right. And that has been Dr. Darius Kofi Osei, CEO, the University of Ghana Medical Center. He just joined us for a conversation on the UGMC as it has completed phase 2 of its development. Well, this is how we actually draw the curtains this morning on the AM show. It's been refreshing as we've spoken about the fuel price hikes, trying to find some solutions to that headache that we find ourselves in or having as a country, and wrapping with the UGMC. For all of you who did the watching, we're very grateful to you every morning, and we look forward to your company tomorrow as well as we wrap the week. But don't you forget, right here on this network at 10 a.m. and at noon, we bring you our major bulletins. It's been a pleasure. My name is Benjamin Akapo. Let's catch up same time tomorrow. Have a good day.